Heidi Otway, your host for this Conversations on Cannabis virtual forum brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about initiatives that could impact veterans who use or want to use cannabis as medicine. So let's talk and learn about this subject with our guests. Dr. Barry Gordon has built a career working on the front lines of the American healthcare system. After years of working in the emergency rooms up north, he moved to Florida and started the Compassionate Cannabis Clinic to treat patients with chronic illnesses using cannabis therapy. Dr. Barry, it's great to have you back on the forum.
Listen, it's an honor every time, Heidi. And listen, everybody knows that the state's dollars for their medical cannabis card contains some, of it, in for this educational initiative. So I call this the official educational arm, of the state's program. Always an honor. Thank you so much for inviting me.
Thank you so much. And our other guest is William Davis, who is based in Louisiana and the president of Euphoria Eats, where he makes and sells hemp-infused foods. William is a U.S. Army veteran who used his passion for cooking and catering to create an alternative way for people to consume hemp and CBD through food. William, I'm looking forward to learning more about you and your experiences. Welcome to the forum.
I thank you. I'm excited to be here. This has been a big pleasure of mine. So I'm all ears and I'm ready to give you guys information.
Wonderful. To everyone joining us on this live program, please share, post, and tag a friend on Facebook to have them join this conversation. If you're on YouTube, share the link so others can join us as well. During the forum, we want you to send us your questions in the comment box, and we'll do our best to have our guests answer them. We also want you to tell us what you think about this forum by completing the survey that will be posted in the comments on YouTube and Facebook after the live program. Your name will be entered into a drawing on June 8th, 2023 to win a $100 gift card provided by one of Mary's partners. Now, let's start this conversation on cannabis. Dr. Gordon, I'm going to start with you. Tell us what prompted you to start your medical practice that treats patients in Florida using the cannabis plant to treat their qualified conditions.
Well, Heidi, I'm an emergency medicine trained physician. And, as you said, front lines of emergency medicine for 34 years, all up in Ohio. The three things I never saw in a emergency setting was an acute problem from cannabis. A little bit different these days with some of the edibles and cannabis hyperemesis syndrome and things like that. But in my career, it was never a day-to-day problem. We never saw a husband or wife team or any domestic partner team beat up their partner after using cannabis. That tended to be much more of an alcohol-associated event. Mm-hmm. But more importantly, on the chronic side, we didn't see the chronic problems from cannabis, even though we knew that people were using it out there. Whereas alcohol, of course, on both an acute and chronic basis is daily in every ER. But, just as importantly, and probably most importantly, no one has ever died in anybody's hospital emergency room from cannabis. Mm-hmm. Nobody ever will. And that's scientific because of the endocannabinoid system, not affecting the respiratory centers of the brain versus alcohol, opiates, benzodiazepines alone or in combination. And I'll be honest, the third thing that I never had in my career, I never lost a partner or a friend to cannabis. I lost them to drugs, alcohol, women, gambling, tobacco. And now in this day and age, of course, every age, depression and suicide, gun violence, of course, now the leading cause of death in the pediatric population. So you have to look at 2023 as a very unique era of both society and medicine. It's not easy to be a doctor these days, and it's not easy to be a patient either. So my philosophy now is that we need every arrow in the quiver to help our patients in the healthcare environment of 2023. And that includes this uniquely ancient healthcare plant-based alternative and all about the endocannabinoid system and science behind it. So that's why it was really an answer to what I had seen societally and knowing that cannabis needed to be much better understood and integrated both into healthcare and society itself.
Yeah, thank you for sharing that background. William, you're an Army veteran that now runs a business creating and selling hemp-infused foods. So what prompted you to start your company?
Well, what prompted me to go and start at Euphoria Eats was a dual purpose. had a buddy of mine, his niece had MS and a couple of other issues. And so they were giving her a Rick Simpson oil, which she hated the taste of it. And so at the time I was doing a competition cooking here in Louisiana and in South Texas. So I had an extra barbecue sauce and I just mixed some up and I said, hey, let me get the horrible taste out of it and let her see if she likes it or not. Well, it was a winner. She loved it actually. And the other reason why I had to do this is because I needed it myself, not knowing that I was going to be addicted to opioids and from PTSD and acute anxiety disorders. So it was a therapeutic means for me to go and wean myself off the opioids, as well as help the everyday individual who has issues that cannabis can help.
Wow. Well, thank you for sharing. I want to kind of dive in because, William, you sell hemp-based condiments and infused foods. And then Dr. Berry, you're recommending medical cannabis that has THC. So I think for our audience, can you, Dr. Berry, explain what's the difference between the THC medical cannabis and then the hemp so that we have a good understanding of how the two of those are different?
Yeah, for sure. First off, William, thank you so much for your service. And, you know, as we head into Memorial Day this weekend, I always remind everybody that, you know, to wish somebody a happy Memorial Day isn't really what the veteran wants to hear. The veteran wants to hear the honor and the memory, right, of those they served with, those that didn't come home, the sacrifice that you all made. So, you know, I tend to look at Memorial Day a little bit differently, I think, than others, because I've been reminded by, you know, so many veterans how important it is to remember. So thank you so much, William, for the sacrifices that you made. And what you were referring to, and Heidi, it's so interesting because you've had so many guests on your program. You know, I want to get you into my podcast, The Green Room, and ask you about what you've learned. Because, listen, I don't think you came in as a Willie Nelson to cannabis yourself. And I know that when you do your interviews, you learn in each interview, right? Yeah. And it for sure. And I do too. And I've been doing this for a long time. So it is a give and take between everybody. But I think one thing that you've heard out of William, that you've heard out of many guests, is that it's often a personal experience, right, that leads them into the cannabis space. So in William's case, as he said, it was helping a friend, okay, with their problem and also realizing that he himself could benefit. Right. And just to get back to your question, he used the term RSO, or Rick Simpson oil, and just very importantly so, to describe what that is a processed plant-based product into an oil that is what we call, and it's a funny term, the dirtiest of the processing. Dirty sounds bad, but in cannabis processing, dirty is good. Okay. That means the least amount, okay, of all the plant's compounds have been removed while it's been converted into an oil. Why is that important? Because it's not just the THC or Delta-9 THC primarily, which is the main potent ingredient in cannabis and the one that leads to the mental intoxication from cannabis, right? Always will. But it's all of the other cannabinoids, the CBD, the CBN, CBC, CBG. I know William knows it, but to the general cannabis world, they know the THC aspect of it, and we're learning now about all of the other cannabinoids. Delta-8 has a role to play, but that's another discussion. From the plant itself, it's THC and then the other cannabinoids. Rick Simpson oil preserves all of those other minor cannabinoids and things called terpenes, and flavonoids, all those minor chemicals in the plant that we just don't know yet by research, because we haven't had the chance to do the research. What really is opening the door, turning the key, helping a lot of the symptoms. So the Rick Simpson oils, especially in the cancer world, in MS and Parkinson's, people that want that concentrated form of the best of the plant use that as their product.
Yeah. So speaking of research, we know that this year Congress was trying to launch clinical trials for veterans to use cannabis as a treatment for pain and PTSD. Dr. Berry or William, what's the latest on that?
Very disappointingly so. There's still hands up towards research. It's frustrating. I do want to give a shout out to the positive for my congressman here in Florida, Congressman Stubbe, who's been really integral at the VA level of trying to codify. And let's just get into it. What stops veterans from getting their cannabis cards, right? Or even using over the counter hemp products, right? There's fear, of course, of losing your VA benefits.
Right.
There's fear of not being able to get medical care through the VA.
Yeah.
And here's the good news, and William, correct me if I'm wrong on it.
Okay.
The VA at this point, as it stands, cannot deny benefits, okay, to
Right.
a veteran over his usage of appropriate medical cannabis with a card. What they can do is deny prescribing hydrocodone or other narcotics, Ativan or other benzodiazepines. But in most settings these days, the VAs are becoming much more understanding about their veterans' desires to use cannabis, right? So that's the good news. Now, Congressman Stubbe, very importantly, is trying to codify that into law. So now it's policy within the VA world, but of course it'll be much better when it's codified, into law. And those are the small but very important steps that are so important as we go forward within the VA system.
Yeah. So, William, as a veteran, how are you getting educated and about cannabis, the legal side of cannabis use? How are you and other veterans getting your information through the VA and others?
Well, let me start off with how I attain this information. I'm self-taught. I go to a lot of conferences. I speak with a lot of doctors from every corner of America that you can find. So I taught myself how to go and curate and cultivate cannabis, as well as the different purposes and uses of the plant. And as the doctor said earlier, there's still a million other things that we don't know quite just yet. And so it's just one of those things that I can't go out and Google everything. You have to go and read, actually, and do your homework and ask professionals on what are the benefits of it, what are the things that you see as of now about cannabis. So in terms of the veterans, I just go and regurgitate everything that I know to them in a more simplified manner and form, because a lot of people don't quite understand all the technical words, all the different CBDs, CDOs, and everything else. So you have to explain it to them and make it more palatable for them to understand. So that's how I get all of my information. I go straight to the horse's mouth and I ask a million questions. As well as having a company, you have to have a lot of lawyers who are in the know or who know somebody that's in the know. So I pay for a lot of the information as well. So it's kind of like a lava lamp. You always have to evolve with the information, because there's not one way that you can go and possibly know it all unless you're a doctor and you're in this industry right now.
Yeah. And, the laws are a lot different from the laws in Florida. So, Dr. Berry, we tell everyone on the show, if you're in Florida, go to the Florida Department of Health Office of Medical Marijuana Use to learn about how to legally obtain medical marijuana card here in Florida. And Dr. Berry will be listed as one of the 2,000 plus physicians that are qualified to recommend cannabis to those who receive the card. So, William, can you give us just a quick snapshot of Louisiana's law? What is their law?
Well, how I attained my medical card here was I had to get a recommendation from a doctor. And being as I have a PTSD already on record, that was my proof of me and needing this this medicine. From there, you go to a handful of pharmacies who have all of the control of the cannabis in Louisiana. On the medicinal side of things, and you go there and give them, I think it's $150 to get a card, and then annually you have to go and renew this card. So those are the steps here. But if you don't have any of the documentation, you have to get a doctor to go and say that you have a debilitating illness or an ailment in order for you to go and qualify to get a card or a prescription here in the state.
Okay. Dr. Beard, do you want to talk about Florida? Tell us about the Florida process.
So it's really important in Florida to know that the qualifying conditions that we have in the state are also followed, and I can name them off. It's kind of so ingrained, but very importantly, they're similar, likewise, or as comparable conditions that physician advocates here in the state. Listen, let's face it. Physicians in this environment need to be safety officers. educators and advocates for their patients. Here in Florida, especially, we have snowbirds that come down every year for 5 or 6 months from Canada, from New York, from Illinois, from other legal adult use environments of California and Colorado. I mean, Florida attracts everybody. So you have people literally coming down to Florida who are using cannabis safely, appropriately, have reduced their Ativan for sleep or Ambien for sleep. They're drinking less alcohol, less narcotics, but they may not have a qualifying condition, quote unquote, to be able to enroll in the program. But very importantly so, we have PTSD as one of our qualifying conditions. And while I would never equate Williams PTSD with a police officer's PTSD or an EMT's PTSD, we all have our own life experiences. But if you're safely obtaining cannabis and using it successfully up north, and then you're here in Florida for 6 months, and listen, I've had these discussions with the politicians in the state. They need to understand that my role is to be a safety officer for that citizen that comes to Florida so that they don't need to go to the drum circle, so to speak, in our area or some other illegal source of trying to find cannabis, very unsafe and illegal, of course. But also, I'm not going to recommend going to the liquor store, and I'm not going to pull out an Ativan prescription for that patient. They've successfully gotten off of that. So the advocate's role as a physician in Florida is as an educator. And William, you hit upon it. Most important thing is the education and the safety. Yeah. Each and every veteran, each and every citizen, okay, should be able to obtain the safe with educational access to a substance that people are using already successfully in so many areas of the country and the world. We're stuck in this very interesting kind of halfway zone. We know that we're going to get to legal adult use in Florida. Heidi, you've had shows about Smart and Safe Florida, I think, and where we're going, or, you know, legal adult use, what's coming down the pike. But I tell everybody in the medical world, we need to keep the quality of our product with the labeling and the testing, okay, appropriate, with no taxes, right? Because we're an untaxed system. And as we go forward, the job protections, the in-hospital and nursing home assisted living use, a home grow option for our patients. There's a list of things about that long that are going to be years long struggles here in Florida. And you, William, because you're in Louisiana, you're going to be 6 or 7 years behind us. Okay. Yeah. So I'm a glass half full guy. I always will be. But, you know, you see Harry Anslinger behind my shoulder over there, you know, and he's just an example of where we've come from so many years ago from the complete prohibition. And now, listen, we have battles to fight. But I'm much more glass half full guy. It's so much better than it was before. But you're going to be behind us for a good 6-7 years, no doubt.
Yeah, I want to go to William, because William, you did not always use medical cannabis legally to treat your PTSD. So tell me about that experience that kind of helped you get to where you are now.
Yes, well, actually, I was hooked on opioids pretty bad there for a good 3 years towards the ending of my college there. So I just was like, well, how do I get off this? And nobody had the answers then, because this was along the time when the opioid epidemic first hit, and everybody really didn't know a whole lot about it. Well, when you go to these doctors and they give you 120 of hydrocodone and you get hooked on them, and you don't notice you're hooked on them until your attitude changes, mood swings, and now you're sweating profusely because you haven't had it. So I said, well, let me try something different than this. And so I tried a recreational cannabis, which I do not recommend because you don't know what's in it as of now. But then I did it ignorantly, and I didn't know any better. And that was the only form of alleviation that I could get at the time. And it alleviated me from having to depend heavily upon the opioids versus me going up to my local corner and getting what I needed.
Yeah. So listen, Heidi.
I was going to ask you.
All due respect, you were protecting me, I think. Hang on. William's not the only person on the show right now, okay, that's used cannabis illegally.
Right.
You know, I'm 67 years old. I had an entire emergency medicine career, okay, where I had drug testing in my contract. I went to work every single day with honor and integrity. And if there was ever a day that I showed up for my ER shift unable to perform my life-saving duties, quite frankly, in the ER, I took it damn seriously, okay?
Yeah.
And I did have drug testing in my contract every day, but that's the unique ability of cannabis consumer to slot it appropriately. And listen, I was an alcohol guy. I did 12-hour shifts. Nobody wanted me doing a 7 p.m. to 7 a.m. shift in the ER, going home and doing 3 shots of whiskey to get my 4 or 5 or 6 hours of sleep before going back to work at 7 that night.
Mm-hmm.
So there's been an undercurrent of appropriate cannabis consumer use. And listen, Tommy Chong is the one who said it's all medicine. Okay, that's not my line.
Mm-hmm.
But I just want to make sure that William wasn't hung out to dry there.
Oh, no.
I know. But my point is my point. I'm happy to come out to the extent of letting people look at my past life history.
Mm-hmm.
Never step foot in a court of law. They can't get me now. I'm more than 7 years out of the ER. And seriously, and not to tout anybody's horn, I was a pretty happy and pretty well-loved ER doc. So it's just a very interesting world that we live in. And tearing the cover off of that is a big part of what we do.
Yeah, I think the goal here is really to remove those stigmas, right? Because again, cannabis is cannabis and people use it. And so, Dr. Berry, I want to kind of segue to what William said. He used the recreational because he needed relief. Are you seeing veterans come to you in similar situations, and how do you treat them?
The most beautiful thing about it, Heidi, is William's experience that he described about being able to reduce or completely remove narcotics. Okay. That's sleep medication as well, Ativan, Xanax. Listen, I'm never either or guy, and it's a hallmark to my practice. I never take a patient who comes in on a list of meds that high and says, listen, if you don't come in on half of those meds next time, I'm going to be disappointed in you, and you should be disappointed as well, because that's why you're here. No, why the patient is here is to feel the best they can. And every single patient wants the least amount of pharma impact that they can. That's why they're coming to see me. And I use the patient's motivation, quite frankly, in the reduction of their medicines. Not me, not their pain management doctor, their psychiatric doctor. Nobody forces patients to reduce medications that don't want to. My advantage is all of my patients do want to reduce their pharma. We educate them in how to do it. We empower them in how to do it. We respect our patients enough. And I'm going to call out the doctors in the state right now, who's ever watching. I hope every doctor in the state is taking the time and respecting each and every patient, especially every veteran patient, with educating them about what this plant can do. If you're not respecting the patient to educate them about a plant that you should also respect as the medicine that it is, then you're not providing a medical cannabis experience, you're providing a card. And there is a difference. So I say patients demand that education from your doctor, because that's where the magic occurs. It's the motivation of the patient and the education provided in how to use the plant the best way that it can be used.
Yeah. So Dr. Berry, when you have veterans coming to you because they have a qualifying condition, are you collaborating with them and maybe their VA provider? Because it does say that from the U.S. Department of Veteran Affairs, it says that they can educate veterans about cannabis, but they don't have the legal authority to recommend it or to help veterans obtain it. So how do you work with them and their clinician or their physician through the VA?
It's such a great question, Heidi, because, essentially, patients don't always want you necessarily commuting back and forth with their doctor. Many patients haven't yet discussed it with their doctor. I have an entire lecture on my computer called How to Talk to Your Doctor About Medical Cannabis.
Right.
And my recommendation is to leave yourself out of the conversation in the first person. So William, for example, if he didn't know how his VA doctor felt about the cannabis program or the use of cannabis, just ask them, point out, do you have any experience with the medical cannabis program? Do you have any patients, not any other patients? Do you have any patients in the medical cannabis program? That allows you to open up the dialogue to hear what your doctor has to say, right, without him taking bias against you. And the good news is, in general, the answer you're going to hear today is that I didn't learn it in med school. There's no residency program for it. but I do know about it. I do have patients in it, and we need more research. Okay. Right. Very few doctors will say, oh my God, pot, dope, weed, grass, it's a drug. Don't do it. Stay away from it. The best answer is it's that Dr. Barry guy and other legitimate medical cannabis doctors that can provide this. We pray and wait for the day that the VA docs can formally and fully participate in the process. And we're open door every day to those doctors and nurse practitioners, quite frankly, and other mid-levels that want to come and learn about medical cannabis. We've had a lot of docs in, including some VA docs here that want to learn about it, even though they can't do it.
Very good. So we got a question from Tracy. Can we pull up Tracy's question, please? She's watching on YouTube. She says, what can you do when you are a veteran, but you still work for the federal government and you're getting drug tested every so often? Is there any law in place to protect that veteran and its job?
So it's state by state right now, and some of the northern, more liberal states have put in some job protections. We surely don't have it at the federal level. The federal Schedule I designation, of course, is one of the most important things that needs to fall. Here in Florida, we do talk about job protections. It gets dismissed every year at the legislative level, unfortunately, not really ever really getting a fair hearing out of committee, but we're not going to stop. Most likely, you're going to see that happen in the public sector employee field first, and then it will go out into the private sector. On the other hand, very importantly so, here in Sarasota Memorial Hospital has added a new page to their employee handbook that states that if you hold a medical cannabis card and you come to work unimpaired every day, you're welcome here. That's doctor, that's nurse, that's respiratory tech, that's housekeeping, that's nutrition, that's everybody. And that's a singular hospital who's made that statement and stance. And I can't say that I had a lot to do with it, but I did meet with their CEO and discuss the issue about 5 months ago. So we're thrilled about it. We have nurses now currently that have gone back to work at Sarasota Memorial Hospital because of that policy. So it's slowly changing is the answer. But right now you don't have the protections that we want.
Yeah, interesting. So I want to ask you all both, what kinds of questions do you get from veterans? You know, William, you're making infused foods. You know, my mouth was when you were talking about the sauces and all that kind of stuff, right? So what kind of questions are you getting from your fellow veterans when you're out and about and you're talking about your products? What are you hearing from them? And then Dr. Barry, I want to go to you to find out, what are you hearing from veterans in Florida? So William, what are you hearing?
Well, a lot of my veterans ask, is this legal? Can I ask my doctor about this? Because here in Louisiana, you better not ask your doctor about medical marijuana at the VA. I just did it 2 weeks ago. He was like, don't do that. You know, you cannot do that. And I'm like, well, the federal law says otherwise. You just don't want to talk about it. Then I just tell me that. So I get a plethora of questions like a proper dosage. You know, what do I need? Do I need indicas, sativa, hybrid, etc.? And I said, well, I can't honestly give you a recommendation because I'm not qualified to do so, but I can point you in the right direction. So it's just mainly educating them on what does what, the hemp, the CBD, the THC, just pretty much educating them on what all is in the bottle or in the plant at the time. And I also get a lot of, how do I get my license? So there's not a lot of information out there to help the common Joe Blow to know where to go exactly to get their license, how to go and attain it in the proper manner or fashion. So it's just a lot of the basic questions that you would get at any other doctor's office, but just related to cannabis. And so I just try to answer them as specifically as possible. And I make a little handout with FAQs on there. So hopefully I can help them in any kind of a manner. And I also have my email address and my phone number in case they need to call me.
Yeah. Dr. Barry?
Listen, veterans come in every day. It's an honor to assist them in their care. A lot of it depends, of course, on what their past cannabis usage history is. You know, we have our Doobie scale, William. You'd like it in our clinic. Doobie 1's never done. Doobie 2's used to do. Doobie 3's set me free, current adult use cannabis, you know, citizens. And then we have Doobie 4s that are Willie Nelson, Snoop Dogg, Tommy Chong, people that have done it every day. But you have to understand that the Vietnam veteran often has used cannabis for years. They've had to go out to their garage at a certain point of their lives so their kids wouldn't find them. You have to treat them entirely different than, and I heard your story when we had the pre-call, someone different than yourself was coming into cannabis for the first time as an adult, right? So
Right.
you have to understand that a patient's past cannabis use has everything in the world to do with the recommendation of the, how they're going to use the medicine now. And, we never go milligram of THC dosing because there's too much variability over the past, use of the patients. You mentioned terpenes and cultivars and things like that. That becomes a little bit more specific for those people that really have a lot of experience with cannabis, because sativas or certain terpenes will energize, indicas or certain terpenes will sedate, and they can be opposite for certain people too. So you're wise not to give specifics to the extent of your recommendations, but always to let people know that it's the THC fundamentally that's going to be your more active ingredient, and then your other cannabinoids that are going to add your balance, your anti-inflammatory effect, and other things. So each patient needs to be treated individually with the respect that, of course, everybody would want as they would go into any doctor's office. So you need to keep it a medical experience. Veterans, Heidi, it's gun rights, quite frankly. It's CDL, commercial driver's license, issues. It's the ability to live a life that you want to live in spite of using a substance that still hasn't gained the acceptance, that it does. And stigma, to a certain extent, it's interesting. That's kind of melted away a little bit. I think most families accept, especially in the veteran population, that whatever is going to help that veteran maintain the best quality of life that they can.
Yeah.
But we tell the veterans to bring their families in with them if there's hesitance. We're all about educating everybody to the extent of the appropriate use of the plant.
Yeah. So, William, any closing thoughts on this conversation on cannabis, about veterans and cannabis use? Any closing thoughts you'd like to share?
If you are a veteran out there who is in need or have any questions, please feel free to reach out to me in any platform or any capacity. But please always think about the alternatives to opioids. This is a natural plant, that will not harm all of your main organs and things of that nature. And as the doctor said earlier, you can't overdose on this stuff, y'all. You just have to educate yourself and see if it's applicable to you and your needs. So get the proper help. Talk to a licensed individual that knows about this. Do not ask your grandmother. Do not ask your cousin. Ask somebody that actually knows about this, and use it responsibly.
Thank you. Dr. Berry, closing thoughts.
Yeah, it's funny, William. Sometimes grandma knows a lot, and no, I'm teasing, but I'm not. Jamaican grandmas, of course, have been making teas and poultices and things of that nature, forever. So, I say that the key is 2023 living, recognizing that we've all carried a computer or a cell phone around in our pocket for a number of years. The kids have grown up differently, ducking under their desks for school shooting drills. And just in general, society is so busy and different. And as I tell people, listen, if you're one of the 10 or 15% of the population, including our veterans, that can get through life with no substance use at all, biofeedback, exercise, whatever it may be, God bless you. And that's a very healthy lifestyle, and I fully support it. But in general, in 2023, most people will utilize something. And surely, if you're going to utilize a substance, be moderate, be smart, be safe. And if it's going to be cannabis, use the caution to make sure that the products that you're obtaining are safe and regulated and tested, and then get that education that's going to enable you to utilize that particular medicine or legal adult use product in the most appropriate of manners. That's always going to be my interest as a physician, is in making sure that the safety and the educational aspect is always there for every substance, cannabis included.
Thank you. Well, Dr. Berry and William, thank you both for being guests on this Conversations on Cannabis virtual forum, brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. Thank you to everyone watching this program. Tell us what you think about this forum by completing the survey that will be posted in the comment boxes on YouTube and Facebook after this live program. If you complete the survey, your name will be entered into a drawing on June 8th, 2023 to win a $100 gift card provided by one of Mary's partners. We also want to encourage you to go to the Florida Department of Health Office of Medical Marijuana Use website to learn how to obtain a legal medical marijuana card in the state of Florida. We also encourage you to go to Florida A&M University's Mary website to learn more about this initiative, its educational programs, and additional information about cannabis use in Florida. Thanks, everyone.
Thank you.